a loud crack, a cry of pain. In that terrifying moment, would you know what to do? In a broken bone emergency, the first few minutes are the most critical. Your actions can prevent more pain, save a limb, and even a life. Stay with us because in this video, we'll show you exactly how. Welcome to Health Springs, your hub for practical health and first aid guidance. Today, we're sharing life-saving wisdom from timeless books like Where There Is No Doctor, adapted for our modern reality. This is crucial knowledge that everyone should have. Now, a very important reminder. This video is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified health provider for any medical condition or emergency. Your safety and the safety of the injured person are always the top priority. When a bone breaks, the first thing to do is keep calm. Don't panic. The goal is to stabilize the injury and prevent more damage. The most important thing you can do is keep the injured part in a fixed position. This is called splinting. You can use materials you find around you like sticks, cardboard, or even a rolled up magazine. The key is to support the limb both above and below the injury. Let's start with a common injury, a broken wrist or arm. If the bone looks out of place or if you suspect it's broken, here's what you can do. First, if you have someone to help, one person can gently pull the hand and another can gently pull the arm to try and line up the bones like this. This needs to be done gently and steadily. If the person experiences extreme pain, stop immediately. Once the bones are somewhat aligned, create a temporary splint. Use strong, flat materials and secure it firmly but not too tightly with cloth strips or tape like this. The goal is to keep the wrist or arm from moving at all. After securing, try to get to a health center immediately. Now, a more serious type of break, a compound fracture where the bone actually breaks through the skin. The biggest danger here is infection. Your immediate actions are critical. 1. Thoroughly clean the wound and the exposed bone with boiled water. It is absolutely vital that the wound and the exposed bone are as clean as possible. 2. Never push the bone back in. This is extremely important. Do not try to push the exposed bone back into the wound. You could introduce more germs or cause more damage. 3. Splint the limb. After cleaning, carefully splint the limb to prevent any further movement like this. 4. Seek immediate medical help. The person will need antibiotics to prevent infection, and a medical professional will need to properly set the bone and close the wound. Do not delay getting them to a health facility. Moving on to other serious breaks. Broken ribs. These are incredibly painful, but often they heal on their own. The main concern is to ensure the broken rib doesn't puncture a lung. If the person coughs blood or has difficulty breathing, they need immediate medical help. Otherwise, focus on pain relief, like taking aspirin if available, and try to keep them as still as possible to allow healing. Broken thigh bone. This is a very serious injury. It's best to splint the whole body to keep the thigh bone completely still like this. This involves using long, sturdy supports along the entire length of the leg and body. The person must be transported to health center as quickly and carefully as possible. How to safely move an injured person. Sometimes you'll need to move an injured person to get them to safety or to a medical facility. This needs to be done with extreme care. The key is to move them without bending their body. If possible, gather several people to help. And with great care, lift the injured person without bending him anywhere like this. Have another person put the stretcher in place. This could be a makeshift stretcher. With the help of everyone, place the injured person carefully on the stretcher like this. Remember, the more people helping, the less strain on any one part of the body and the less risk of bending or twisting the injured person. Now, this next point is perhaps the most critical warning in this entire video: broken necks and backs. If there is any chance a person's back or neck has been broken, you must be extremely careful. In fact, if you are not a trained professional, do not try to move them at all. Trying to change their position can cause permanent paralysis or even death. The best thing to do is to keep them absolutely still where they are. You can use bags of sand or tightly folded clothing on each side of the head to keep it from moving, like this, until professionals arrive. Knowing these first aid steps can truly make a difference in an emergency. Remember, the goal is always to provide stability and immediate care, but these are temporary solutions. Always get the injured person to a professional medical center as quickly and safely as possible. We hope this video from Health Springs has been helpful. If you found this information valuable, please give us a thumbs up, subscribe for more essential health tips, and share this video with your loved ones. Your support helps us bring more vital health knowledge to our community. Until next time, stay safe and take care.